So good morning, everybody. This is Susan Henderson from Disability Rights, Education and Defense Fund, also known as DREDF. And thank you for joining us today. This week's question and answers is—
Hi, this is Robin Shafford. I had placed a catering order for today on Wednesday, and I just wanted to make sure we're all set because I was told that the charge would be run through this morning and I haven't seen it. So I'm just checking that we're set for our order.
Hold on, I'm going to mute Robin. There we go. Sorry about that. So again, this is Susan Henderson from DREDF. Welcome to this week's questions and answers on COVID-19. I see I made a typo and said COVID-10 on the slide. Sorry about that. This week, we're joined by Tanesha Morris and Michael Escobel from Resources for Independence, Central Valley, and they're going to talk about their work collaborating for COVID equity for people with disabilities. I guess primarily down in the Central Valley where we really need this with this work. I just wanted to let people know that we have Spanish interpretation. And to get the interpretation, you go to the icon down at the bottom of the screen with a globe and it says interpretation. Click on that and select Spanish, English to Spanish. Next, we also have closed captioning by Tony today, not by Tony, and ASL by Tammy. To see the closed captioning, click on the CC button down at the bottom of the screen and captions will appear. Also, we have ASL, like I said, and Tammy is spotlighted. And so if you go to the gallery view at the top right and click on her video, the 3 dots, and select pin video, you will always see her. And you can make Tammy bigger by grabbing the edge of the right edge of the slide and moving it to the left. And that'll make the slide smaller and Tammy and Michael and Tanesha bigger. Please keep your mics muted during the presentation so we can make sure we're hearing everybody, and your cameras off so we make sure Tammy's easy to find. At the end, we'll have, if anybody has questions, we'll provide as many answers as we can. And with that, I'm going to go ahead and stop sharing my screen and let Tanesha share hers. So thank you. And again, thank you for joining us, Tanesha and Michael.
Thank you so much, Susan. I really appreciate it. We are very happy to be here with you guys today. And thank you also to the rest of the DREDF staff also for having us and inviting us to come. Let me just go ahead and get my PowerPoint in presentation view. Okay. So my name is Tanesha Morris, and I'm a program manager with Resources for Independence Central Valley. We are located, our main office in Fresno, California, and we do serve 5 counties, the main counties in the Central Valley area of California: Merced, Fresno, Madera, Kings County, and Tulare County. Today, we're going to be presenting to you a little bit about our collaboration for COVID equity for people with disabilities. I'm also joined today with me is Michael Escobel. He is one of our staff, our ILS staff, which is Independent Living Services staff at our Visalia office. And he is also one of our staff that works directly with the COVID-19 equity project. So just to start with the community impact, the surge of COVID-19 has really only highlighted concerns and inequities that have already existed for people with disabilities. It really has disrupted all of our lives, from how and where we obtain services to how we work, how we go to school, how we socialize, how we understand and respond to the gravity of the situation, in addition to so many other ways and aspects of our lives. It really has impacted every one of us in every way that possibly we could think of. Because of that, it has really been brought to our attention to bring disability to the table. That has happened because Fresno County Department of Public Health received CARES funds that assist the residents, or to assist the residents that are affected by COVID-19. And they sought partnerships with the community benefit organizations to carry out goals such as education, isolation, quarantine support, contact tracing, and outreach. And disability organizations raised the issue at the time that disability was not being addressed and the disability community was not being included. So from that, the Disability Equity Project Coalition was formed.
Okay, my name is Michael Esquivel. So thank you for letting us be here today. The Disability Equity Project Coalition organizations, they are Accessible Payment Parents Unlimited Inc. And they have young children and families. Deaf and hard of hearing service, and they are for deaf and hard of hearing. Easter Seals, Central California, for children and families, and Resources for Independence for Central Valley, for young and adults with disabilities. In United Cerebral Palsy, Central California, and they're for adults. Valley Center for the Blind, and they serve people who are blind and low vision. Next slide, please. The DEP highlights outreach and substantial community education for challenging to reach populations. Financial support for people with disabilities impacted by COVID. Case investigation support for Fresno County. Tasks taken on by Valley Center for the Blind. Vaccination clinics and vaccine registration and coordination. Next slide, please. Staff training. 32 staff within the DEP project were trained by Fresno County. Staff learned to navigate county sites in which cases and requests for services were inputted. The DEP team assisted in development of accessible training modules so staff who utilize screen readers have access to all of the information provided. Ongoing training is being provided to keep staff up to date when provided services.
So the vaccine clinic partnerships that we have going on thus far, the Disability Equity Project has partnered with CVRC, which is Central Valley Regional Center, and with the Department of Public Health. And they have provided 2 private clinics for our consumers. The team registered over 500 persons with disabilities and staff to get vaccinated from those 2 private clinics. RICV was able to invite staff from all of our offices. We have 2 satellite offices as well as our main office. And we also invited all of our consumers from any county that we serve, all 5 of the counties I mentioned earlier, to get vaccinated as well. Transportation was arranged through the EOC and provided to those who requested that service. And we all worked together to provide an environment that already had accommodations in place. The on-site ASL and other language interpreters were provided. Staff was there to assist those who needed guiding. There were chairs available for those who needed to sit. There was open space enough for essential social distancing. And those who requested mobility devices had enough space to move around as well. There was also brailled information and an electronic version emailed upon request to anyone who did request that.
Ongoing vaccination clinic partnerships. The lead Disability Equity Project organization has received funding from Kaiser in support of the ongoing efforts by the Disability Equity Project. A partnership with the local UCSF will host a weekly vaccine clinic on every Tuesday for persons with disabilities who want to get vaccinated. at Fresno City College. Incentives are being put into the place to address vaccine high-honesty. Extensive and extensional outreach is being strategized, especially in rural areas. RICV will meet with Kaiser to learn if our site will be a good option to hold a clinic. Next slide, please.
Yes.
Ongoing vaccine clinic services offered through DEP, registration assistance if needed, pay for or provided transportation, provided assistance at vaccine site if needed, answer vaccine and COVID-19 questions, coordinated in-home vaccines for people who cannot leave their residence.
So we're connecting with our rural communities as well. The RICV Disability Equity Project staff are working currently on specific outreach that targets the rural areas of our counties, all 5 counties that we have. There are some significant rural areas that we serve. So we are specifically working on outreach to get to those folks also. We're searching for more outreach opportunities for those hard to reach areas. We're trying to meet people where they're at in the community. And we're advertising in hotspots such as taco trucks, churches, flea markets, restaurant businesses, and other organizations throughout our communities that we serve that are well established in those communities so that we can try to reach as many as possible. We're providing and offering incentives for people to come and learn about vaccines and to register for vaccines. And we're also providing that so important connection to the resources and information referral services that people need so desperately. We're addressing vaccine hesitancy by really, well, as a part of President Biden's plan to expand COVID-19 vaccines and the Center for Disease Control partnering with the Administration for Community Living to provide funding. So that funding we have opted into to help try to increase the availability of vaccines for people with disabilities and to address the barriers that people are still facing at this point. Some of the activities that we will use the funding will include ongoing education, of course, because that's one of the points that, you know, finding folks that are still a little hesitant may not have all of the education that they would like to have, all of the knowledge that they would like to have as far as the facts surrounding the vaccine. So we're going to be providing ongoing education, of course. We're also going to be scheduling vaccine appointments, or we are already, and we're going to continue to do that, assisting in arranging transportation to and from vaccine clinics, identifying those people who might need in-home vaccination and assisting the arrangement of that to happen in the county that they're in. We're also continuing to reach out to local health departments to develop partnerships so that we can provide technical assistance on vaccine accessibility and help those agencies and those sites that are going to be or are already providing clinics and setting up clinics for vaccine to make sure that they are accessible for those who have disabilities to be able to get there and to use those services on that site as well. We're also partnering with other independent living centers to do statewide outreach. And of course, as always, we are providing resources and information and referral services to anyone who inquires and needs that. So we really have enjoyed being able to come and share with you guys all the wonderful things that we're doing and that the Coalition and Disability Equity Project are working together to try to achieve. We would welcome any questions that you have and welcome you to follow us on Facebook if you want more information, or if you'd like to give us a call or visit our website at ricv.org, please feel free to do so.
So thank you, Michael and Tanesha. Do you mind if I ask you a few questions?
Sure.
So, so I hear the same thing that you've probably been hearing, that there's been, fewer, that there were the demand for vaccines, especially now that we have enough vaccine, seems to be flattening. People aren't looking as actively for it. And there's there's a few reasons for that. You mentioned vaccine hesitancy, or, people who can't leave their homes. And it sounds like, that RICV is addressing those folks who you need to have the vaccine in their homes. I heard on the news lately that interviews from people who want to get the vaccine, or they're interested in getting the vaccine, but they just feel they don't have time. So that, even if they know that there's a clinic, pop up nearby, they're at work, and then they need to rush home to get dinner. Have you guys thought about your outreach, about strategies for those folks, these folks who just can't seem to, prioritize because they're so busy with other things?
That's a great question, Susan. Thank you. And one of the ways that part of the hesitancy is trying to be addressed right now by all of us in the coalition, as well as other agencies, is the fact that the vaccines are being made available in many more places, not just clinic sites, but also places like Walmart, Walgreens, CVS, so that you could just go on your lunch break, pop in, get your vaccine, and then pop out and get back to work. So that it could be as quick and seamless as possible for those folks that are having that issue right there that you're bringing up. So thank you for bringing that up. That's a very good point. Yes. Michael, did you have something you wanted to add also?
RICV is also making a video. A lot of our consumers will be doing the importance of getting the vaccination and why it's important to get vaccinated.
Absolutely. Yeah, we are also putting together a video that or a series of videos that we will be utilizing peer-to-peer services and encouraging that connection, that peer-to-peer connection with staff that have been vaccinated, and also consumers who want to share about their positive experiences with getting the vaccine, and of course including an education within those videos as well, and information about those quick sites that are available now to everyone, so that everybody who is on the fence or not sure or just needs some more information to make an educated decision can have that and have that comfortableness. Hopefully we can help address that by having those peer-to-peer connections in our videos.
That's great. If you share those with us when they're ready, we'll make sure to share them on our social media and in our newsletters too.
Absolutely. Wonderful.
And I'm wondering, is there, now that it's the vaccine is available to youth 12 to 15, are you doing a whole nother sort of round of outreach about that?
Yes, absolutely. We will be putting together, including that in our outreach. And as I had mentioned on one of our slides earlier, we are in the works of getting ourselves approved, or seeing if it would be a suitable site at our RICV main office in the Fresno area, so that we can actually have a clinic there for folks to come and maybe drive through, or or whatever works. We're trying to figure out how we can coordinate that at our site, and we're pretty centrally located in Fresno, so it would be a great place for people to easy access. And we do have a youth department at our agency, and we serve youth. And so being able to incorporate the outreach and the sharing of the information with our youth department and all of our youth participants now is a big part of that outreach as well, because now it's officially safe to go ahead and say, hey, you guys are eligible for the vaccine also. And so we want to make sure that we're educating our youth and we're helping them to know the facts so they can make those decisions and with their parents and get the vaccine also. Thank you. Great question.
And I'm sorry. And also starting May 18th, Fresno City College will be 12 and older will be able to get their vaccinations starting May 18th. And I can send the flyer to whoever send, was that Susan or?
Yeah, that'd be great. And we can send that out. We can share that with social media.
Mhm.
Yeah.
And
Yes,
it's in English. It's in
Mhm.
English and Spanish.
Good.
Yes, and they're going to be having that particular clinic at Fresno City College every week on Tuesday. So definitely we can share that flyer information with you.
Okay. And so just, before we go, what do you think has been your most, as an IELTS CIL, what's been your most successful outreach, do you think? Like, what tips do you have for other organizations reaching out to disabled people and their families?
I think that really, really important for other agencies who are trying to reach their disability community is the education piece, and just really striving to provide that that welcoming atmosphere and the information that sometimes can be elusive to all of us, and a little bit overwhelming to even, to everyone, trying to understand or decipher what it means, what the ingredients in the vaccine, or what the statistics mean. Sometimes that can be a little daunting. So as an agency and as a community who's trying to reach out to our youth and older and adults who have disabilities, trying to make sure that we're being very transparent and that we are providing that education piece in plain language that everyone can really understand and is very clear, I think is a really important piece for reaching that population, those persons, and helping them to feel comfortable with what they're learning.
Well, thank you. Thank you, Michael and Tanesha, for doing this, for doing the work, for leading it down in the Central Valley and joining us today. It's really important to get all of this information out. We're in this for the long run, right? Just because, the 18 and overs have been getting vaccinated, we still have 16 and under to get everybody vaccinated, and all the folks above that who haven't been. So we'll keep in touch
Absolutely.
and make sure that we share information.
Wonderful. Thank you so much for having us, Susan, and everyone else. We're glad that you guys were able to join us, and we hope that you all have a wonderful Friday.
Thank you. And thank you to our interpreters and Tony, our captioner. Take care, everybody.
Bye-bye.
Bye-bye.